And perhaps let's keep the surgery in mind as a kind of backup option if this isn't going anywhere and you feel differently about it. But I think, in a sense, a physician who felt that form of treatment was so contraindicated might simply have to say, I can't treat you on that basis. Let me recommend someone else. But, to whatever extent possible, I do believe in the physician trying to work with the patient around their preferences. Another, perhaps simpler example might be somebody who is an avid exerciser, and the physician says, well, you simply have to stay in bed for 6 weeks. The person is not going to do it. Maybe they'll do more harm. And so the physician might know they're not going to do it and talk with them about it. So, well, how about this? We'll negotiate 2 weeks of bed rest and then, a limited amount of movement, but no hard exercise, and revamp it to listen to what the person is really desiring. Yeah.
I'd like to offer a kind of variation on what you're saying, which I think is still very sympathetic with it, and that is how it compares to your own thesis. It seems to me one could say that there's really nothing wrong with the techno-scientific paradigm of the body. That in fact, it's only with that paradigm that medicine has been able to do anything. I'd like to know if you think this is factually correct. My impression of the history of medicine is that it's only very recently that doctors could really do very much at all about serious illness. The problem that you're addressing isn't that paradigm as such, it's the extension of that paradigm everywhere. And so that we have nothing else. In particular, we have since that paradigm can't speak about goals, we're silent on the issue of goals. We have no goals in medicine. It's just simply, as you point out, again, I'm very sympathetic with that, nothing but getting these machines working again. But that doesn't necessarily have to follow from taking the body as a machine. In fact, that could be the best way to take the body because that's what works. What we need is that paradigm in a larger context. Is that
Yeah. No, I think that's very true, that as a tool, these scientific and technological forms of treatment are very powerful. So one certainly doesn't want to take that paradigm and just throw it out. But I think if we were able to say, well, here's a particular way of scientifically modeling the body in a way that gives us forms of diagnosis and treatment that are helpful, but we understand this isn't the final and overarching paradigm. It isn't the truth of the person. It's not going to dominate all the phases of the medical encounter. It's not going to give us the true ends of the medical encounter. Then we can use it in a very effective and selective way. Basically, you said it very nicely. I have to agree. In the back there?
You were saying that earlier, how modern medicine teaches the doctors and residents to think of people as machines instead of people. And as a philosopher and a doctor, you have knowledge not only putting the abstract and putting in real life situation, and you come up with any ways to kind of solve this problem?
I'm not sure what you mean. In actually working with patients?
Or just coming up with ideas of how to actually. Philosophers think in broad abstracts. You have the knowledge, take the abstract, put them down in something that could be considered workable, and you try doing that.
As a different way of practicing medicine? Not to any great degree. I mean, my sense of the kind of thing I'm talking about today is that if it were to play itself out, if you were to start with the kind of larger philosophical context and work off of notions of the human self that have been derived by other 20th century philosophers, more integrated notions that don't start from mind-body dualism but begin from a kind of holistic concept of the self, it could give rise to a form of medicine that would be first of all, would treat the person in a much more humanistic fashion, that would begin to take more regard for therapies, forms of treatment that are now regarded as pretty non-traditional. Things including, visualization or meditation or other forms of self-healing. and would incorporate them in along with these medications and surgeries. So I think you would end up with a different style of doctor-patient relationship, and also a kind of broadening spectrum of forms of treatment that have become respectable within medicine. But I have not tried to work that out in any great detail, I must confess. Was that? Personally, I know very little about it. So I can, I have some, very vague impressions that are no more informed than that of anyone else in the room. I certainly don't mean to imply by this critique of medicine that thereby any form of treatment that has been called holistic or homeopathic or naturopathic is necessarily helpful or necessarily bad. I guess I'm just saying that many, many forms of treatment haven't been adequately thought about and investigated because they don't fit into this paradigm. There isn't a very easy mechanical explanation to be given. So in a way, if we kind of move out of this paradigm to some degree, the territory becomes opened up. And there may be forms of treatment that go back to things like the Middle Ages and witchcraft and all kinds of primitive cultures that have long since been thrown away as unscientific, that we might rediscover as actually having some validity in ways that we can't yet understand because of the restriction of our paradigm. So I think the territory becomes open to these kinds of unorthodox forms of treatment, but at the same time, some of them may be bogus. So, yeah.
Started off, well, you're saying that the techno-scientific paradigm of modern medicine is needed to explain the physician's myopia, this multi-dimensional field, those possibilities. And I think I agree with that in general, but I also think there may be a social dimension to it as well. That particular paradigm is often partly constitutes the identity of the doctor in the setting where he or she is working in relationship to other medical practitioners, perhaps different approaches to medicine, nurses. And I'm wondering if this social identity isn't necessary to explain this kind of idea too. You might say there's a struggle that goes on with different status within the profession. I can give an example. I work on a psychiatric team in Saskatchewan, and on this team there would be a psychiatrist, there would be a psychologist, there would be a social worker, and a psychiatric nurse. The idea was that everybody was supposed to participate equally in the treatment of the client, the patient. But very quickly the psychiatrist would tend to say no because of our specialized knowledge, and because ultimately all medicine, being psychiatric medicine, is related to chemical dimension, scientific dimension. We should have ultimate say. So we took power from that view. So I'm wondering if this typical scientific paradigm, although one of the reasons it's adopted because it's so dominant in our society, it also has something that also views it as an explanation for this type of myopia, that you might have to include some dimension of social analysis or social study.
Yeah, I think you would. I mean, I think that's a very good point, and you're more equipped to deal with it than I am. But I think it's interesting that I did frequently use the term physician and doctor, and sometimes I'd say healthcare provider. I think this paradigm is especially true in the so-called upper echelons, the physicians, the surgeons. And as you, quote, move down the ladder in terms of social status and economic status to, nurses or PTs or orderlies or whatever, probably this paradigm slips a little bit because you're in a position where you will have more personal contact and you will often be seeing the dimensions of the person that the physician who marches up to the bedside for 20 minutes and does the quickie physical exam need not encounter. So I think to call this the ruling paradigm is to say it's particularly associated with the ruling classes of the healthcare professions. It's also, you could do a patriarchal gender-based analysis and say it's particularly associated with men. Because if you look at the traditions of women's healing, going back to things like witchcraft and lay women healers in the Middle Ages, and even today, the nursing profession, which women are more heavily represented. You tend to have more of an acknowledgement of the subjectivity and the personhood of the patient. So this distanced, objectifying, mechanistic stance can be identified, I think, with capitalism. It can be identified with patriarchy, all these different social dimensions. I'm glad you brought that up. So, thank you.
Very much.